I've seen in the emergency room, ER nurse edition, tetanus. Tetanus is a bacterial infection caused by Clostridium tetani. People usually know it as as infection caused by a penetrating wound. It can be caused by any wound or burn that hasn't been treated in a timely manner. It can be caused by open fractures and also by certain animal bites or scratches. When anyone comes into the emergency room with a wound, we want to make sure we thoroughly clean the area and do any debridement if needed, which is medically removing any damaged, infected, or dead tissue. Because it is easier to prevent tetanus rather than managing the clinical syndrome. So if someone does come in with tetanus symptoms, which is typically how we diagnose tetanus, there is also a serum test, but we don't wait for serum results to start treating a tetanus patient. Symptoms include lockjaw or trismus. There's back pain, dysphagia or difficulty swallowing. There's muscle stiffness and spasms. The spasms can involve more and more muscles as the illness progresses. So when a patient does come in with those symptoms, we want to make sure we secure an airway because the muscle spasms are not only painful, but they can be potentially life-threatening because they can cause airway compromise or respiratory failure. Muscle spasms are controlled by benzodiazepines. We will also start antibiotics. The antibiotic of choice for tetanus is metronidazole. When anyone comes into the emergency room with a wound, we do want to ask about their tetanus immunization history. So whether it's a clean or minor wound or whether it is a tetanus-prone wound, we will get that history, and that will kind of lead us on to how many tetanus vaccines they'll need, if they need a booster or not, or if they need human tetanus immune globulins. The tetanus immunization is when a baby is born, they get the initial 5-dose series, which is given at 2 months of age, 4 months of age, 6 months of age. The 4th dose is given anywhere between 15 to 18 months of age, and the 5th dose is given between 4 to 6 years of age. The first booster is between 10 to 11 years of age, and a booster is needed every 10 years. Pregnant women at every pregnancy will receive a Tdap vaccine, typically between 27 to 37